just like Aesthetically Speaking. Start now.
Hey, everybody, and welcome back to Aesthetically Speaking. This is episode number 4 already, so I'm super excited about that. Today is actually one of the days that I have been thinking about since I started this whole podcast. If you've listened to all the other episodes, I have talked about this one treatment in every single episode at least once. And so it's finally here. So this is the episode that I'm going to be talking about laser toning, everything, what it is, why you should do it, all the fun stuff. And I have, again, one of my favorite people in the world here, and that is Carissa McCormack. So welcome. Yay.
Thank you. And I feel the same. I love our
Awesome. Well, so again, like one of the reasons why I like having you, obviously we talk all the time and we just have good dialogue back and forth in general. But one of the reasons why I want you to talk about this is because you've used so many different devices for the same treatment. And I mean, let's just dive right into kind of what laser toning is right off the bat. How do you describe it to somebody?
So when somebody asks about what are we doing? I'm like, we're taking a laser and we're using a gentler approach. So there is no downtime. If anything, they might have a nice glow afterwards. But it feels like warm rain on your skin. And what it does is it stimulates collagen and elastin in the skin. So over time, you're actually getting a really nice beneficial buildup of both of those things, which means better texture, more even skin tone. Uh, we'll get into that, I know, when we talk a little more in depth. But what ends up happening is people do it and they're like, my skin looked so good. And people complimented me.
Mhm.
Is that just temporary? And I'm like, the nice thing is that part, that glow is a little bit temporary when you do it, maybe a week or two, but over time it becomes your skin.
Right.
And
Yeah,
it's
I
like,
always tell people whenever I go into an office, especially training wise, if we're doing a device that is a 1064 wavelength laser, I always talk about toning because that's essentially what we're talking about when we're talking about toning. But I always tell them it is like the unsung hero of the laser treatments. Even though you don't get this big like super aggressive treatment with lots of downtime and I
mhm,
mean these in crazy before and afters, I feel it like it is one of the most underutilized treatments in the entire industry. And I think that it is the one thing that people should be doing all the time. um, just like going to the gym. And every time I say it, I say it's the same kind of thing. Just like going to the gym, being consistent with that treatment is going to over time give you that amazing bang for your buck with the no downtime like you talked about. You get this nice glow. I mean, you literally could do it right before an event. And I almost call it like an Instagram filter. So the next day you're going to have these nice like uh shrunken pores and you just get this nice glow that's like the Paris filter on Instagram. So
it's so
um
true, which I can use right now. Actually, can we work that
right,
out?
exactly. I loved one of those. I haven't had one in so long.
Uh,
But essentially, like we said, you are stimulating collagen. But let's talk a little bit about why that is going to be different from the traditional laser treatments, like the subablative, non-ablative treatments, because essentially what they're doing, those are creating coagulation and mild resurfacing. So you get that sandpapery kind of texture after those treatments. With this, you don't. So it's almost just like heating up the skin just enough to like denature collagen and start stimulating new collagen elastin fibers, correct?
And I mean, I will be the first to say when it first came out, I'm like, this is a bunch of BS. Like, there's no way this is going to work, blah, blah, blah. And then I was in a situation where I had moved to New York City actually and started working for a doctor that had one laser. And oh, okay. And it happened to be the one that started the laser genesis name. And I thought, well, okay, there are people patients who like it. Let's just kind of go with it. And I started to do it. And I was like, oh my gosh, this is crazy. Like, this is actually way
Yeah.
better than anticipated. And I had always heard about it as gateway laser. Like, you
Hmm.
do it
Oh,
and it's like a
100%.
gateway drug. And then you
Yeah.
get like, what else can I do? But it was amazing to me, the applications it had.
Hmm.
So to that point, what it will do is it does stimulate collagen and elastin through heat versus destruction. So I think a lot of lasers end up kind of creating an injury, like a little, poke a hole, like we talked about with CO2, and then your body heals the wound. With this infrared heat or near infrared heat, what you're doing is you're stimulating enough where your body is actually saying, hey, I will kind of reorganize the collagen I have and start promoting the growth of it. But it
Hmm.
also stimulates elastin. And there actually is a study about that, which a lot of lasers actually don't seem to do. So when you cause that destruction, you don't necessarily get the snapback elastin. And that's what really we all want, right? I
Right.
mean, I wish I could
I hate
just,
the word, and everyone yells at me. I hate the word skin tightening, but
that's a
your
whole.
skin will look a lot firmer, tighter,
Mhm.
smoother,
Absolutely. Yes, the tightest
because
skin
of
is
that.
scar tissue, so we don't
Yeah.
want that.
Yeah, we
But we
don't want
do
we don't
want.
want scar tissue.
Right.
But so let's talk a little bit about, okay, so laser toning. If somebody just wants to come in, yes, you're getting that collagen elastin, but overall you're improving like tone, texture, pigment, pore size, redness all over time.
Mhm.
And why is that? So traditional laser toning is done with a 1064 long pulse laser, correct?
Correct. The
So
ND-YAG.
yeah, an ND-YAG long pulse laser. It's important to note long pulse laser because there are those short pulse lasers like nanoseconds, like the Q switch lasers and picosecond lasers.
Mhm.
Now you can do laser toning with those, and we're going to talk about that too. It just kind of happens in a different way. But the reason why 1064 is such a great wavelength for toning is because you're getting one deeper, and 1064 penetrates a lot deeper. But we talk about chromophores, or targets within the skin, right? And anytime that we talk about those targets are blood, water, and melanin. Well, if you want to be like specific, it's oxyhemoglobin, deoxyhemoglobin, so blood, and that's going to be your reds, melanin, your pigment, and then water, which is going to be your collagen synthesis. So, that being said, if you do traditional radio frequency, for example, traditional topical radio frequency, that was always the go to, quote unquote, collagen stimulation and skin tightening. Again, quote unquote.
Yeah, yeah.
Right. But
Yeah.
and that's done through heat. So that heat stimulation is stimulating the collagen like we would with heat in laser toning. However, I always tell people laser toning is 1,000 times better than that traditional radio frequency topically because of those targets. You're getting blood, water, melanin. So over time, you are going to get an improvement in all of those things. And the best part is with 1064, it's safe for everybody. So skin types 1 through 6.
Mhm. As dark as it can
Right?
be or as light as you can be, it doesn't matter. I mean, it
Exactly.
matters in how you approach it as a technician, but not
Right.
necessarily, yeah, everyone can do it.
Which later on in the episode, we're going to talk some clinical pearls. So keep listening. We're going to say, hey, darker skin types, we like to kind of do this. Lighter
Mhm.
skin types, we like to do this. So make sure you listen all the way through so you get all those fun little tidbits. But I've had actually quite a few client experiences because in the beginning, very much like you, um, not that I was like, oh, this is kind of BS. It's not. It's just people have to be consistent with it. Now, I have uh, two patients specifically. Both, one is in their late 70s, one is in their late 60s. The one in their late 60s, I have done so much stuff with her. We've done microneedling, we've done 1927 thulium resurfacing, and then we did laser toning. We did one laser toning, and she said, I think this was the most impactful treatment we've ever done. I mean,
Like, oh my gosh. And
obviously, I know that that's
yeah.
not 100% true, but she could see so much difference just with that. Granted, the one treatment thing, don't tell your patients that, but you will see that nice glow. So she was happy with it, obviously. That's one. My mother-in-law, me and Miranda from our energy-based versus injectables episode, we actually talked a little bit about laser toning as well. And then with laser toning, with Miranda, we were saying, oh, we got to pick somebody to just do laser toning on. So my mother-in-law, I sat down with her, and she doesn't like anything that hurts. So I said, look,
Fair.
yeah, said, listen, Marilyn, we're gonna said instead of doing anything else, I only want you to do laser toning twice a month, and we're gonna do that for at least 6 months. And when I tell you, she every time I see her now, she gets so excited because she's like, I can't wait to do another one. And yes, she got that glow, but she will tell you as well that she noticed a difference in the actual texture and the feel of her skin after treatment 4. So again, it's not just like an overnight thing. It is a cumulative uh, type treatment. So as you do more, you are stimulating more collagen. So not only is it that great over time treatment, it's a great maintenance treatment as well.
It
Um,
really, it's tell you what, it's just one of the unsung heroes. And
I know.
again, most people are like, "Oh, yeah." And you know, you do there is a technique to it that needs to be done properly. I think,
Right.
over the years, probably people just kind of went, "Oh, you just wave it across the face and that's it." And I'm like, "Well, no, you have to actually
Yeah,
heat
you
up
have to
the."
be particular about
Yeah.
what you're doing.
Yep. And
Uh,
I'll throw in just one more thing. Acne patients. We've had
uh-huh.
Now, granted, acne and melasma are two very complicated, very individual type of conditions, both of which can benefit from this. So we'll kind of
Mhm.
get into that. But I feel like with acne, some people, I had acne in my 30s, like mid 30s. It was so weird out of nowhere. And for me, I had to do something different. But I worked with a doc who she was treating this one guy who had really pretty profound acne. And he didn't do Accutane. I think he tried Accutane and he couldn't stay on it because he had liver problems with it. And she had tried, she's like, this is my last ditch effort. And for him, laser genesis actually helped him the most,
Yeah.
which was not everybody. Now, please don't hear me say this is for everyone, but it will kill the P. acne bacteria. It took away the redness that was already present. And it really made a big difference. And the poor guy had been through so much that I think he
Mhm.
just needed
Yeah.
an easy, like a gentle touch as well. So yeah, I think it's just so good. So
That's awesome.
we will keep talking.
Yeah.
Yeah.
So 1064, we already know is the wavelength. However, there are other toning applications as well, like with 755, for example. So 755 is going to be still attracted a lot more, though, to your oxyhemoglobin, deoxyhemoglobin, and melanin. So it will be a little bit better for some browns and reds over time. And then the water absorption, though, is almost nothing with the 755. So you're not going to really get that collagen stimulation. So it is like a nice little kind of add-on boost if you're already doing your
Mhm.
1064 laser toning. So everybody out there, just be aware. Yes, there are quote unquote settings and modalities to do 755 toning, but that is going to be specific to more so browns and reds, not collagen applications.
Correct. And also, and we might be getting too nerdy, but with a
No.
long pulse 755, you are limited to um, probably a skin type 1 through 4, which would be,
Mhm.
4 being maybe Asian, Hispanic, kind of that
Yeah.
J Lo. She might even be a little dark. It just depends. But I feel like there are Pico 755 devices that can be used in for laser toning on all skin types, but
Right, right.
that gets a little bit more complicated. So we'll talk.
Exactly. Well, and that's actually bringing to us to our next point is
Mm,
long pulse versus short pulse. So
mhm,
again, there are 1064, 755 um, applications of long and short pulse lasers.
mhm.
But what people have to remember is long pulse lasers are in milliseconds. Without, again, getting overly nerdy, those milliseconds are going to essentially allow heat to stay in the skin and heat it up to a proper temperature. Now, when we're talking about short pulse, meaning like Q switch nanoseconds, picoseconds, um, that being said, you are kind of breaking things up, pigment wise, using a photoacoustic shockwave. But then that photoacoustic shockwave, that vibrational aspect of the skin, that what's happening, is also stimulating collagen. So when people ask me if they have two different types of lasers, they have a short pulse and a long pulse, well, which one do I use? Well, who is your patient? And that's first and foremost what you have to think. Who am I treating? What am I treating? So, for example, if you have somebody that has melasma that's really bad, that's exacerbated by heat, I don't want to use my long pulsed one when I have the option to do a nanosecond or picosecond laser, because that is going to minimize the heat. I'll still get all of my collagen stimulation. I'll still get improvement with browns and reds, and I'll be able to address them a little bit better without the potential of aggravating melasma more. Now, can you use a long pulse with melasma? Sure, you can. You just have to be careful of the heat aspect.
There's actually a
But
study of using both, which we can
yeah.
chat about too. But yeah, so long pulse is basically like you have it on. If you have a long pulse or pulse duration, you're kind of simmering. You're gently heating, but you're doing it over a long period of time.
Mhm.
If you have a short pulse duration, you're putting that stove on high. And then if you have a pico or really, short pulse duration, you're not using as much heat, but you're using, like you said, that photoacoustic. So you're physically, mechanically breaking up a target, right? And so with less heat, you're able to do a similar thing, which I don't know if I just helped that or hurt that. We might have to cut that part out. Anyway,
No, yeah, but that's it. You're on the same page as me, and as far as kind of what we say, it just depends on your application. They're both going to do similar treatments, and there is laser toning, so to speak, with both of those types of devices. But again, like, so say somebody has more redness in their skin. I prefer a long pulse because, again, that longer pulse duration, think simmering
Mhm.
versus kind of breaking things up, that simmering is going to be better for your vascularity in patients. So I prefer a long pulse laser, whereas where somebody, like we said, with melasma, I may choose to do a, picosecond or nanosecond laser, just to minimize the heat aspect of it, and just do it based solely on that photoacoustic shockwave that's happening. So there are different devices, and like you said, you used one of the first ones that was ever even out that kind of coined the term laser genesis. Is usually the term that people use. I like laser toning, but that's I think it makes more sense because a lot of people don't understand what Genesis means.
Yeah, it's more of a
Um,
brand name. So,
right. So that being said, out of all the lasers that we both have used, I prefer the Lutronic or Cynosure Lutronic Clarity 2 as a long pulsed 1064 755 laser. What about you? Like, do you have a reason why you like that one?
so there were a few actually, and I'm biased. I'm not gonna lie. So I had used the original one, a few of them that were able to do laser toning. The thing I liked about the Clarity 2 is you can use it has two wavelengths, so you can use your 1064 for all skin types. You can use 755 for people with pigment that have a slightly lighter skin type, not light but lighter. But what I love is you have the ability to use a much bigger spot size, so I can
Mhm.
actually force that heat a little deeper and really stimulate collagen. But it also has a temperature gauge, so it will sense the temperature of the surface of the skin. So you know when you have hit the therapeutic level, but you also know if you're getting too hot. I mean,
Mhm.
you can have someone on the table and they're like, "Hey, it's hot," but if they're not at the therapeutic level, if I stop the treatment, they're not getting any kind of
Right.
so what's really nice about a temp sensor that's built into the handpiece, is all you have to do is adjust your settings so it's more comfortable for the person. It may take a little longer, but you're in that sweet spot where I will stimulate collagen, shut down blood, random little capillaries, help stimulate elastin and get the maximal benefit. Plus, with a larger spot size, it often doesn't take as long to get to that therapeutic temperature. So it's my preference.
Yeah, completely agree. That's why I love it. And I tell people all the time because they'll say, "Oh, I've had this device or that device in
Yeah.
the past." I mean, there's a couple of that I'll say. Uh, I mean, Gentlemax Pro was
That's,
the thing for
yeah.
years.
And it's a
And
great device.
it's a
Don't get me
great
wrong.
device. Yeah, it's a great device. But the thing is that temperature sensor is incredible because the problem was with a lot of the Clarity 2's predecessors is it didn't have the temperature sensor, and you never knew if you were truly at temperature unless you get like a thermal gun. You're also
From
doing
Home
that while you
Depot.
treat. Yeah,
Yeah.
and so I mean it's way too much going on. And so people would say, "Oh, I don't really like laser toning because it didn't really do anything." Well, to be honest, you probably weren't at a therapeutic temperature.
Probably weren't getting a great treatment. And
Yeah.
probably the person doing it was like, I have way too many things in my hands here trying to
Right.
make this work. So,
Exactly.
like, in their defense, but
So that's probably like my biggest reason why I like that device the most
Mhm.
out of all of the ones on the market for that. Now, let's just like add a little bit about how it should feel. The way I describe it to people is like you're laying in very hot sun in Turks and Caicos. Like
I love that.
so like you said, it's supposed to be that gateway laser, right?
Mhm.
People that don't have high pain tolerances like me, I'm a baby, I think everything hurts.
You're not that bad.
Um, but people should enjoy the treatment because they should be getting it. I mean, you could get it as soon as every 2 weeks.
Yep,
So,
absolutely.
I mean, that being said, you want them to come in. So just when you're explaining it to people, you don't have to it doesn't have to be a painful treatment. Like you said, you're able to adjust settings. Even if you want to go a bigger spot size, maybe you lower your energy a little bit or something like that and make it more tolerable for them. Because as long as you can get to that temperature and build that heat, you're doing a great treatment. Just a side note, as far as settings go, obviously every laser is a little bit different. Later in the episode when we go over some clinical pearls,
Get really nerdy.
I mean, yeah, exactly. I am gonna get a little nerdy, and I mean, I'll say my favorites. You can say your favorites, of course. But just keep in mind for the people that are listening, that may not be for your device. So obviously, do your due diligence and check what you're trying to do. But I have my favorites for my favorite devices. Carissa has her favorites for her favorite devices, and you guys should not just rely on what you hear from other people that don't have the same device as you.
This is for entertainment purposes
Right,
only.
exactly.
No, I mean, and yeah, you do. Obviously, you need to know your device. Like, you need to know your car before you drive it too. But yeah, I think overall there are similarities between all of the devices and in
Yeah,
terms of the technique and what, kind of at least the pulse duration is. And then from there,
exactly.
but it really should feel like warm rain. It kind of has that,
Yep,
like, you feel like a little doo doo doo, but you also, it is like laying in the sun. And sometimes you're
yeah,
laying in the sun, you're like, oh, it's getting too hot. So I tell the person,
right,
I'm like, if it feels too hot, raise your hand, say, hey, too hot. I might not be moving the device fast enough. I can speed it up.
correct.
I can turn the energy down. There are a lot of ways you can adjust it, but if it's painful, it's not where it needs to be.
Right, exactly. So, first and foremost, let's talk a little bit about spot sizes since you brought that up. Most of the time, our spot sizes can range from very small to anywhere from like 18 to 25 millimeters, depending on the device that you have and the country that you're in, um, with a long pulse laser. So, that being said, I want people to think about ice cream cones. I always use that as an example. The, like you said, you're able to force that energy a little bit deeper, right, with larger spot sizes. So, if we go into an ice cream shop, that ice cream shop has all the different kinds of ice cream cones, the small sugar cones and the big waffle cones with the peanuts and the chocolate and all the fun stuff. So the bigger ones that have a bigger circle to fit more ice cream in are also longer. Same rule applies when you're talking about a 1064 beam, or most beams for that matter, because you basically have where it hits the skin, and then it almost kind of cones down a little bit. It's almost like more of like a U shape a little, but that's because that light is still getting some impedance from the skin. So it is going to kind of like wind down essentially and make a cone shape. So if you want to penetrate deeper, you need a bigger spot size. If you want to not penetrate as deep, you need a smaller spot size. So think about other things. So why do we need deeper penetration? Like you said, for more collagen stimulation and also potentially deeper pigment. Now, when do you have to? Oh, well, not to mention, like when people have a lot more redness in their skin, I use a bigger spot size because all blood vessels are deeper as well and capillaries. Now, when do you have to be careful about that? With your darker skin types, because their melanocytes are deeper in the skin. So I don't want to be using a very large spot size on someone's face who I don't want to aggravate melanocytes. I want to be a little bit more superficial. So maybe I'll use like an 8 millimeter or something like that. Because I'm just trying to even out skin tone on the surface. I'm still going to get some collagen stimulation, absolutely, but I really am not going to be injuring melanocytes, you know?
You don't want that's no good. And actually, the 8 millimeter is fine. And
Oh, totally.
the original settings used a 5 millimeter, and it
Yeah.
was pretty superficial. So what you had to do is really increase your energy. So instead of having it at, say, I'm just going to give you random numbers like 7 joules, you were up at like 13, 14 joules because to get down, to drill down into the dermis and get enough heat down there, because the spot size was so small, my ice cream cone was so small, so shallow, I had to turn up my energy to kind of push
Right.
down. That actually put the surface of the skin at risk because I'm using more heat.
Right.
It was kind of this like, okay, that's great, but that's all we had. It's all you could do. So it
Exactly.
was like, all right, well, make it work. But with a bigger spot size, I can actually turn the heat down and still get
Hmm.
to my target no problem without having that potential of causing superficial burn. Plus, the temperature sensor helps too. But yeah, it's interesting. I mean, I like, and for the body, a lot of people say, like, do you do this on the body?
Oh, all the
100% you
time.
can.
Abdomens, arms,
And the
um,
body skin's
inner
thicker.
thighs.
Yeah, it's
Yeah.
thicker. And plus you can tolerate a lot of heat. So, what would be if I used a very large spot size on the face, it's a little bit too much. There gets to be a
Yeah.
point where it's like, okay, this is too much heat. I can't tolerate. Whereas someone's inner thigh or, abdomen, they're like, I barely feel it. So you can kind of get a little more
Hmm.
aggressive with your treatment.
Right. Now, ideal skin types. We already said everybody is a candidate essentially. Again, it's just kind of like how you approach that treatment. Most of the time, and this is another analogy that I use, if I'm wearing a black t-shirt like I am versus a white t-shirt out in the sun, that black t-shirt is going to hold heat a lot easier. So generally speaking, when we're talking about pulse rate, not pulse width or pulse duration, pulse rate is going to be your hertz. How fast is that pulsing? How many pulses per second, essentially? Um, I don't need as many or as high of a pulse rate for my darker skin types because they're usually holding on to that heat a little bit better than my lighter skin types.
Yes.
So just be aware when you're treating um, of that setting as well. Because, like Carissa said, like you can adjust things to make things feel a little bit nicer. But if you're not staying at the proper temperature, you're getting too hot. Um, if you're getting too hot, even on your lighter skin types, lower your pulse rate before you decide, let me just change my energy.
Yes, exactly.
Um, and vice versa. If you're not heating somebody up enough, increase your pulse rate before you decide to increase your energy, because you always have to remember energy or joules or fluence, however you want to say it, they're all the same thing, um, is going to be the more destructive of the force of a beam. So you have more potential complications and injuries that can
Higher
occur with
heat.
higher
Yeah.
energy.
Yep. You're more
Right?
likely to burn your dinner on a higher stove than you are on a lower one.
Exactly.
It's just how it is. Yeah, no, and it's interesting with the technique itself. I know we're kind of talking all around. Typically, a laser it's almost like a stamp, right? You have a handpiece, you put it on the skin, and you pulse. And then you move over and you pulse. With laser genesis, you're actually off the skin with your laser tip,
Hmm.
and you're kind of making little zigzags, almost like an airbrush over the skin. So I think that's one thing. If you haven't had it done, there is no contact. It's actually sort
Yeah.
of diffused. And so by moving with multiple pulses per second, we're able to heat up the skin gently as opposed to one boof of
Right.
heavy energy. If I move faster, I may not heat up as quickly. It's like putting your finger through the flame when you're a little kid, which
Right.
super safe,
Exactly.
right? Great parenting, but
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 we all
we
did
all
it.
did it, right? But if you go through fast, it's fine. But if you kind of held it there, ooh, it will burn. So same if it was getting too hot, I could move quicker across the
Hmm.
skin, or I could turn down the number of pulses per second and just keep my normal pace. And that's how you adjust. So there is a bit of a technique. Likewise, there are people who just are kind of like, oh, this is just a pain. I don't want to do it. Like, when they're practitioners,
Yeah.
they want to get it over with too quickly and they're not heating the skin enough. And that's when you hear it doesn't work. It's like, well, mm, it
Right.
would
Exactly. Well,
if
and
you.
that's why when people start talking about like, well, how long do I need to do this for? And you know what I mean? Um, I don't want to say like there's never too much, but I mean, you could potentially do it a lot longer of a time doing it than not. I would say for general skin rejuvenation, you're looking at roughly 1,500 to 3,000 pulses per face per treatment. And I know that that's a decent size range, but again, how quickly can we get that person up to temperature? And are we keeping them at temperature? And how big are those areas? So, for example, on somebody like me, I'm not going to go over my beard line. So, I have a smaller space to treat. So, I might be on that lower end of like 1,500 or so. Then there's other people that have very tiny foreheads. Maybe you're not doing a lot on their forehead, maybe 200 pulses on their forehead. As long as you're getting to temperature and keeping it there for a extended period of time, um,
Maybe a
and
minute,
right, exactly. It
maybe
doesn't
not
need to
even.
be long.
Hmm.
So that's why, like, generally speaking, most foreheads, if we're just doing general skin maintenance, I usually do roughly 500 pulses on a forehead, and I split it up between 250 and 250, and I just do half and half. So usually a forehead's going to heat up a lot faster than anywhere else, because it's such a thinner area and it's right on bone.
And it really just depends. I mean, sometimes like someone like me, you had to turn it down because it's like, it hurts.
Yeah,
Because there is just nothing there. I mean, the skin, bone, and like tiny little bit of fat there to absorb.
right, exactly.
But yeah, and that is a nice thing about the temp sensor because it will tell you like you're at that sweet spot. And then as you continue, a little time goes on, you're going to start to build up heat. It'll start beeping differently. And so,
Hmm.
like, hey, we're done here. We need to move to the
Yeah.
next section. Whereas, in the olden days, we had to just count pulses and we were like, okay, well, we did our number of pulses and we might
Right.
not have
We
heated a
may have
specific.
been there, we may have not
Mhm.
have.
And we may have heated up one area more than the other. So it's just nice to have tools that will guide you in terms of effectiveness.
Yeah.
But
Now, that being said, too, we had mentioned earlier the 1064 versus the 755.
mhm.
Now, there are times too where I will layer the two.
Oh yeah, for sure.
You just have to be, again, cognizant of who you're doing that on, because that's not going to be for everybody. Once you start bringing the 755 into it, yes, 755 theoretically can be on like skin types 1 through 4, but if I'm already combining it with a 1064, I usually only limit it to a skin type 1 through 3, because of all the heat that I just built in their skin already from the 1064, and then I'm layering on top of that. So you just have to be safe about what you're doing, and generally you're going deep to superficial with most treatments. So you would start with your 1064 followed by your 755 if that's what you're going to do.
Yeah, and it gives more of like that IPL photofacial effect. So you're
Yeah.
working on reds, browns, and you're stimulating collagen, which often, if anyone's familiar with IPL or photofacial, you're very superficial. You're working on pigment and some redness, but you're not really stimulating collagen as much as I think we were told initially when IPL came
Right.
out. They're like,
Right.
fine, it does everything. It's like, no, it doesn't. But it works really well on pigment and redness, sure, but
Yeah.
just not as much for stimulating collagen. Plus, it with traditional, again, if you're stamping, you're not building up heat that's happening over time. You're basically just hitting it once and that's it. So an IPL or a traditional laser isn't going to give you that stimulation of collagen that you get with a gentle, continuous heating.
Right.
Gentle.
All right. So as far as the treatment itself, like we talked about it being one of the most underutilized treatments, or like the unsung hero of a lot of offices. And I think a lot of that has to do with, like what we said, people either being undertrained or not doing it properly. Also, it's one of the other reasons why I like it is just because of the fact that you do get a little bit better of an ROI on that. So for providers listening, there's very minimal consumables when you're talking about a laser toning treatment. So it's a high patient satisfaction rate with this. So you are able to make it a little less expensive to keep them coming in a little bit more often. And on the bright side, they're coming in more often. So they're going to ask you questions about other treatments.
Sure.
Patients are going to be happier with their treatments. But um, it's one of those things that if it's easy to do and easy to have people happy with it and doesn't cost you a lot, why wouldn't you do it?
And
Blows my
I
mind.
know. I mean, think people again, a lot of people providers I want the biggest bang for the buck. I want that one treatment and there just is no one treatment. I do feel like a maintenance treatment is so important for everybody. It's like best results when used, right? So if people are
Right.
coming and doing things continuously, they see a progression of it's just like
Right.
working out all the time. I keep going back to
Right.
that, but it's like you don't just eat well one day and then eat like crap for 6 days, right? You
Right.
try to eat well, consistently, and it's those small little things that make the biggest difference. So yeah, I don't understand why people wouldn't use it. I think they're afraid that it's like I thought, kind of yes, like where it's not going to really
Yeah.
do anything. It just to feel good. It makes them feel like they're laying in the sun, and it's like no, it's actually it has such impact and it can be combined with so many other
With so
treatments.
many
Oh my
things. I mean,
god.
even just post CO2, either for maintenance
Mhm.
after your treatment, but also some people get that post inflammatory erythema for months.
Yeah.
And it's going to help with the redness. So, I mean, even after those types of treatments where people stay red or pink a little bit
Mhm.
longer, you can do laser toning to help tone some of that down, um, and have them recover quicker.
Yeah, absolutely. I mean, and you could do it with you could do it with a hydrofacial or a microderm.
Mm-hmm.
Mic there. You can do it before a say thulium laser. So if they have some redness, but they also have some pigment and textural issues. So I mean, it can be combined with so many different things, which is really great. Um, it can be used for rosacea. I mean, we actually used it for surgical scars, believe it or not. I know you said rosacea before, but you can do it on a red raised surgical scar, which is pretty interesting. I remember thinking like,
And help take some of that pinkness
yeah,
out.
and even the bulk, believe it or not, because a lot of times if they're fairly fresh, that infusion of blood vessels is what's making it sort of puffy. Now, it will get a little uncomfortable. That's a little different when you're doing a scar. You actually want to get it almost to swell a little bit, and it
Yeah.
looks angry for a couple of days, but then sure enough, in a couple of weeks, they're like, "Oh my gosh, it's less red, and it actually looks flatter." And so,
Yeah.
why not? As opposed to, hey, let's go in and do a scar revision and cut you open again. So
Yeah. Exactly. Do you, I mean, what would you say to a provider that's like unsure about how they would or should implement that into their practice?
just do it. Like, just try
Right.
it,
I mean,
right?
especially if you have it, because most of the time, a lot of these places have a 1064, 755 for hair
They
removal.
do. They do. Yeah.
And that's all they use it for.
Yeah.
And I tell people all the time, even with a Clarity 2, right now, Clarity 2, I think, is the best 1064, 755 on the market at the moment. Could that change at any time?
Absolutely.
1,000%. However, if you're only using it for hair removal, I feel like that's like driving a Ferrari in a neighborhood where like you just,
Yeah.
I
In a
mean,
neighborhood
it's
outside
nice
of
and
the
people look at
Autobahn.
it.
You're like,
Right,
what?
exactly.
Just get out there.
Right, exactly. Get out there. Like you can do so much more with it than just hair removal. Is it great for hair removal?
Yeah.
100% yes.
It's wonderful.
But I think you're missing out so much on all the other capabilities of a device like that. Um, so,
Yeah.
you know,
Absolutely.
um, what were you gonna say?
Well, I was
Sorry.
going to say too, I wanted to talk a little bit about, you know, how you introduce it and who it's good for, because I also
Yeah.
get, initially it was like, well, who do I tell people, who do I tell about this? And it's usually the person who's like, I really feel like I need more, but I'm not really ready for any downtime. My husband will kill me if I look crazy, whenever I come home there, he's going to know I've been spending money, which I think is always so funny. I'm like, really? Like,
Hmm.
just
Yeah.
but it's always that, like I said, it's gateway laser, but really also the younger crowd. So you can have somebody who,
Hmm.
I had a girl, and she was great. She was a skin type 5'6", and she had acne, and she was coming in for acne treatments. And we were doing, we would do chemical peels, we would do all the things to kind of get it down. But she still had that post-inflammatory hyperpigmentation, and the peels worked to a point, but I think it's because she was continuing to break out. So I was finally like, you know what? Let's just incorporate a lighter version of laser toning. And what was so interesting is she was like, I can't believe this, but my acne, I always call them acne scars. I'm like, it's just a little hyperpigmentation afterward.
Yeah. Like
She's like,
staining.
yeah, she's like, it's lighter and more so than even with the chemical peels. And I think in her case, her staining, good word, had little blood vessels there.
Yeah.
And we weren't shutting those down with the chemical peels, but with the heat of the laser, again, very mild because she was a darker skin type, we are able to shut those down and they were allowed to heal. And her skin ended up being, it was, I'd like to take credit, but really, well, but it was pretty awesome. I mean, it really was. It was like, wow. So sometimes you just don't know, too, what
Yeah.
is contributing to pigment, etc. And so
Right.
try it.
Now, and then with her, how often was she coming for
So
those?
she was a
Because,
student at the time. So she's like, I wish I
okay.
could come every 2 weeks. I'm like, listen, do what you can. So she was pretty committed for once a month, and it was fine. Honestly, I mean, with things like acne, because she did still have some active acne, and it did help with her case. It was kind of that final thing that really broke the cycle. And I think eventually, her skin just started to clear. Do what you can. Sometimes more often is better, but if you can't do it, every, say, 2 weeks, that's fine. Do it once a month. Just don't wait a year. Don't do it once and wait a year and then expect results.
Yes, you can do it as soon as every 2 weeks. Um, I wouldn't go too long without it though. Um, if you're incorporating it with other things, then of course you want to wait a longer period of time. Like maybe you're doing it, like you said, with a hydrofacial or with microdermabrasion. Like maybe you're not doing it every 2 weeks, you're doing it every four, you're doing it every six. That's totally fine. For me, a lot of the times I layer it with that 755, for example.
Yeah.
So I will do my 1064 followed by in the same session my 755. But if they're doing those treatments every 2 weeks, I'm alternating on when I do both. Like I don't do the 755 included in every single one. I'll say this time we're only going to do the 1064. Next time we'll do both. Um, so just be aware of frequency. It just because a 1064 laser theoretically could be done about every 2 weeks if you're doing toning like that, doesn't mean that it should be done every 2 weeks when combining it with other things.
Absolutely.
Right. But speaking of combos, I I mean, add it on to somebody that's like getting an IV drip, microneedling, some kind of tox.
Mhm.
You're not heating the skin up that much. You're not ablating the skin. You're not injuring so much tissue that you shouldn't be doing it. I have no reason to believe personally, and again, I did not do any research on that, but everything that I have experienced, 1064 laser toning with some Botox on top, sure, why
Yeah.
not?
For the people who are like, they're just not willing to take the risk to try it, they want data, right? So I was like, you know what? I know there have been studies, and let me see what they found. And actually, there was a study in Japan. It was in 2011. And one of the really big take homes that they found was that it stimulated elastin. That was like the really big thing, which would contribute to better pore size. Because if you have more elastin, your pores aren't as dilated, right? So you're going to see a change in texture, etc. But what they did, which I thought was super interesting, on like I think 4 of the 50 patients, they actually biopsied them on their cheek, which I'm
Oh,
like,
wow.
wow, why would anyone agree to that? But they did. And it was really interesting because they only did 3 treatments, which, okay, fine. I think they were a month apart. I don't know for sure. I believe they were. And by 30 days, they did staining and they found that it was significantly increased elastin. Like they would stain it, and you can see the pictures in the study. It's kind of cool where, the first one is just like, when you stain something and the more of it there's like more purple. The first one like barely has any purple. The second one, it was like all purple. It was crazy. And then 90 days later, it decreased a little bit, but it was still much more than the actual starting point. And I'm like, okay, so it's not just 90% of the people liked their treatment. It was, we have hard evidence that this actually made a difference in the
Yeah,
skin. And that was
that's
just
awesome.
using a long pulsed 1064, 3 treatments. And I believe it was actually 1 month apart on those. So I thought that was kind of cool.
Nice.
And then there was actually another one we talked about. We haven't really talked about laser toning for melasma. So when we get into that, there was actually one using a the Lutronic. Again, this is older, so it was not Cynosure Lutronic at the point, but it was their Spectra, and they actually used both the short and long pulse on melasma and found an improvement with the combo, which I thought was kind of,
Yeah.
yeah,
Nice. That's
yeah,
awesome. Makes me feel even more
right.
confident about it.
So it's not
So,
just our opinion; it's
yeah.
the
Now,
opinion.
when would you not recommend laser
Mm,
toning though?
I think seldomly, believe it or not, but I would say no. If they have
Yeah.
an open, let's say they have a herpes breakout, right? Let's just call it what it is,
Yeah.
right? You're not doing anything to them. If they have, say, they're someone who has had a lot of extractions and their skin is just open, or they are a
Hmm.
picker, or whatever the case is, you don't want to do it on broken skin. That just doesn't make sense. You don't want to do anything on broken skin. But that was one, that would be a no. Hair, if there's hair in the area and they're concerned about, hey, I might want to, grow a beard later, I'm always like, you know what? There is a chance we're doing very gentle heating, but if I ruin your hair follicle, not the thing for them, right?
Yeah.
Um,
Minimal risk with
Minimal,
that.
but we,
However, because and the reason why it's minimal risk is because we're actually using shorter pulse durations. Um, and so you're not
you're
really affecting the
barely,
hair follicle as much, but you still could, so you should still mention it to
and I
somebody.
will,
But
yeah,
generally speaking, there's very little risk with
and I
that.
will say in 20 plus, no, 23 years, 22, whatever it's been, I have gone over beards where people are like, I don't care, and nothing happened. So
Yeah.
it's just up to them. No, if they have actual hair, it's gonna like not feel good because
Yeah, it's
it
like
pinches.
my length right now I wouldn't do because it'd be like a little
Yeah, it would
prickly.
just not
But
feel
if I
great.
was like shaved or had like 5 o'clock shadow, I would still go over my whole face. The only time, honestly, that I've ever had any reaction to hair loss was doing an IPL on my
Oh, for
face.
sure.
which of
Oh my
course,
God,
and that's
it's the
what's going to
worst.
happen. So when people say, "Oh, I'm using my IPL to extend the telomeres
Hmm.
and improve skin quality over time," that's not for everyone. So I mean, on me, I've had one IPL in my life, and I'll never do it again because my beard got all patchy, which is it's expected that, you know what I mean? Like that's what's going to happen. But it did get rid of a lot of the pigment that I wanted to get rid of at the time.
Yeah.
Um,
Yes.
Granted, could I have done it with a 755? Sure, it probably would have been a little bit better. And again, with those shorter pulse durations, um, it is going to be a little safer for the hair, but yes, it still could affect the hair.
Where did that come from?
I have no
I did
idea.
not
That
touch
was
anything. So weird.
interesting.
Okay.
Um,
Ghost in the machine.
yeah, hope you guys
Thanks for
thought
the
that it was
thumbs
as
up.
cool as they did. Yeah. Uh,
That's hysterical.
anyway, so as far as like protocols and stuff, you were saying with melasma, how do you like to treat melasma with laser toning?
So, the probably the first line of defense would be to use a Q switched laser. So, you're still using the 1064, but what you're doing is you're using a shorter pulse duration, which means you're doing it in either nanoseconds or picoseconds. Sorry, pico or Q switched, and you use very little heat. So, where I might use, I don't know, I'm just going to make it up again, 7 joules of energy on a long pulse laser, I may use 1 joule of energy. So one very small packet of heat. So I'm not using a lot of heat, but what's happening is the energy is going in so quickly that it's physically disrupting the melanocytes. So you're getting this little, what's the word I'm looking for? Yeah, it's photoacoustic, but it's
Yeah,
mechanically
like a
take,
like a
yeah, hmm,
shockwave and breaking it from like big boulders into rocks into pebbles into sand, and
correct.
then like eliminating it that way because you're breaking it into little pieces.
Exactly. And historically when everyone says okay, heat will irritate melasma. It's actually when you're using a high heat laser, you're also causing an inflammation response because you're literally causing cell death. You're using a lot of
Right.
heat to kind of blow up these pigment cells, and that's causing inflammation, which will actually make melasma kind of worse. With low heat, you're not causing cell death. What you're doing is you're sort of stunting the factories. So all the little fingers of the pigment factories are sort of getting like curled up like the Wicked Witch of the West's shoes,
Yeah.
right? So it's not pushing out as much pigment. So over time, you're actually going to see a change in the pigmentation because the body's not hyperpigmenting. Um,
Right.
so that's one of the ways you would treat melasma. That said, and again, this was prior to having access to a Q switch, had one patient, very bad melasma. I mean, and she was a skin type 5-6. So it was all the things that were tough.
Yeah.
And
Yeah.
I was like, we can't do laser on you. We can only try, we did hydroquinone, she did retin A, and it got kind of got worse because of all the inflammation. Then we're like, well, maybe we try a different type of chemical peel. Nothing. And I mean, didn't budge. If anything, got worse. She was like, long time ago I had laser genesis and that seemed to help. And I was like, I will not touch you with laser genesis. She's like, can we
Yeah.
just try it? And I was like, if you're willing, but she's like, look, everything else is making it darker. Why not? Did it. And sure enough, 2 weeks later, she comes in, pigment was lighter. And I'm like,
That's
what
awesome.
is happening? So we kept it up. Now, I was like, please stay on hydroquinone at least just to kind of balance this out. It was a mystery. I was like, I don't know why this worked. Well, about 5 years later, I ran into a doctor who did a lot of research on this. He was from Texas, can't remember the name, but he said, no, no, there's a huge vascular component to some people's melasma.
Hmm.
You shut down her vessels that were creating this sort of pigment and feeding the hyperpigmentation of the melanocytes, I guess. I mean, the reality was, I was like, whatever it was, it worked. I will use it
Yeah.
in my back pocket if I ever have somebody who just doesn't respond to the traditional.
Yeah. Exactly. And that's why like sometimes those traditional treatments they're not going to respond to, like you said, a Q switch is generally the
Generally.
way that
Yeah.
like your way, or Pico, of
Hmm.
course, um, that you would kind of aim those melasma patients toward. That being said, tangent, but like you had brought up that Q switch Hollywood Spectra, that PTP mode,
Oh,
they have PTP mode on there. It's incredible.
so
So
interesting.
essentially what that does is, and again, you can do laser toning with that too. Um, and you're breaking down that pulse into like little mini sub
Hmm.
pulses,
Yep.
essentially. So you're able to actually do higher energy. So I find that with those melasma patients, again, if you're worried about the heat aspect of it, I can deliver more energy to break up more of that pigment by making that pulse smaller, essentially. So they have a Q2, Q3, Q4. So you break it up into either four little pulses, three or two little individual little pulses. And I mean, I can go as high as like 3 joules, like you said, where generally you wouldn't go past
Right,
one.
because it'd be too
But
high.
I'm able to put in a lot more energy that way and treat a little bit better even with one treatment.
Absolutely.
So,
And when you're breaking up, say you're using the Q4, you're creating now, you're taking your energy and splitting it up into 25%, 25%, 25%, right?
mhm,
But you're also keeping your pulses per second high. So now you're
right.
delivering like, instead of like a jackhammer like this, it's like 4 times as quick. So it's really
Right,
feeding back
exactly.
the
Yeah. So if you're at like 10 hertz, it's
yeah.
like doing 40
Yeah,
hertz
it's a
essentially.
little bit, it was like hard to wrap my head around when I first heard it, but I was like, I get it. It's actually allowing
Yeah.
me to use a little more intensity, but in a different way.
Yeah. In a safer
Yeah.
way,
Hmm.
essentially.
It's
Yeah.
cool.
So laser
So
toning from
fun.
all different
It's so
devices. I
good.
love
It's
it.
so good.
Yeah.
And then one little thought on that too. So another study, but it was actually done by in Korea, and it was using the Q switched laser with the what they call, there's a spectra mode. So specifically to the Hollywood spectra, there is a mode where you can create like this what they call quasi long pulse. So when we're doing our traditional long pulsed laser toning, we use a zero point 0.3 millisecond pulse duration, which
Mhm.
is still very short, but it's still technically in the milliseconds range. On the Spectra, they allow you to, they have a mode where you can use that sort of heating range. And it was traditionally used for acne and heating up for the carbon peel. But what they found is that little bit of heat that they could deliver, still at a fairly low energy, would actually cause dermal pigment to break up, which is tends to be there with melasma. So the Q switch worked on the surface better, on the surface pigment, and then the like quasi long pulse worked on the dermal pigment, and the combination made a better treatment than just one or the other.
That's awesome. Yeah. That's another great device that I'm sure I'll have to have an episode about because I
There's
mean
so many things you can do
that
with that.
even the MDF
Oh,
handpiece that just came out
stop.
with that 2 years ago. Oh my gosh, that's
Yeah,
incredible.
it's good.
So that's another day. But
It's another device to play with.
but overall, like when people say laser facial, most of the time I feel like they mean laser toning. Um, Sometimes that is wrong, and sometimes people will associate it with things that have a little bit of downtime or something like that. I mean, sure, whatever it is that you want to do, but as a patient going in, if you see something that says laser facial, I would ask a little bit more about it. And I mean, if you're one of those patients that's listening to me and this podcast and Carissa, you should ask, is it a 1064 laser
They'll be like,
facial or
whoa.
is it right? Or I mean, are we talking something that's like mild skin resurfacing or with like a little sandpapery texture type thing? Because I have gone into offices where they call that a laser facial. Same thing, the word photofacial. The word photofacial has traditionally been an IPL. Um, so when people ask me about that, though that is not the same thing. So if you're either asking me a question or a patient asks you a question, just make sure that people are being a little bit more specific about what that is. Because when people ask me questions, especially about settings or something like that, and they say, what are the photofacial settings? Well, there are none because this isn't an IPL,
Right.
so I'm not really sure what you're asking.
Exactly.
Um, so just be aware that this particular treatment truly is called laser toning. I mean, you can say laser genesis, but I believe that was a trademarked
It
thing.
was like saying Coke or Pepsi
So
to laser
yeah,
toning.
exactly. So that is more of a brand name type thing. So I wouldn't really reference it as that, but laser toning is like the general catch-all term for what most people refer to as a quote unquote laser facial.
Yep.
One of my favorite things to do with laser toning is like redness, like inflammatory redness in the body, rosacea, mild rosacea, not heavy rosacea, obviously, but essentially what you're trying to do again is kind of close down some of those little capillaries with more treatment. So that also might be more pulses. So how we said earlier, you might be at roughly 1,500 to 3,000 pulses for skin rejuvenation. If I'm trying to treat more redness, I might be doing more pulses. So I might do, I mean, if it's bad, I might do 6,000 pulses on an entire face, and you just have to make sure that you're staying at the proper temperature, you're not getting too hot, and you're being safe.
Absolutely. And sometimes you use
Do
a bigger
you?
spot size too, and you can.
Oh, yeah. Again, because that's going deeper. So you could potentially use a bigger spot size for that as well. So it's just going to really be dependent on you and the provider. And as long as they know what they're doing, you're in good hands. Do you have a favorite thing to target or to do with laser toning?
I mean, I love the generalized redness. Like if people have just
Mhm.
sort of that, I feel like,
Like almost
yeah,
blotchy
kind of
red.
blotchy.
That's yeah, that exactly. I
I
love
do
that.
find though people who have like, you know, post-inflammatory erythema, it's so good. Oh, you know what I love it for? Good old bruise. Somebody has a really bad
Yeah.
bruise. Like it could be from an injectable, and they did
Hmm.
had a was doing a training and the new nurse had her lips done and they were purple. I'm not gonna lie. I mean, they were, God bless her. And it was really purple on her upper lip. And she's like, "Do you think this will help?" I'm like, first of all, we have to be very delicate because it can be too, the more pigment you have, the more you'll feel it, and especially with bruising. But I said, you know what? She sent me a picture and it was unreal because you could kind of see where we had treated was very faintly bruised and the rest was like purple around her actual lip
Hmm.
line. So I was like, that was pretty
Yeah.
cool. I mean, that was just like a nice little,
Yeah.
you're not really making your, retirement fund doing that, but it's nice to offer it.
No, but it's like a
Hmm.
little added
Nice to
benefit.
offer it, especially if you were the
Absolutely.
one who caused the bruise. It's really nice.
Right.
So I
Yeah.
do like it for that.
Maybe you do that one like
Yeah, we
free.
might have to throw that in. But overall, I love it with like a combo of some kind of exfoliation first and just you can go get married that next day and you will
Yeah.
look beautiful. Like it's just my favorite
Yeah.
thing. Really.
I know. I love it. All right. So now we're going to get into some real nerdy numbers and
Okay.
settings. I I'm going to talk about mine because I love mine and I think mine's amazing. So I mainly use a Clarity 2. I think Clarity 2 again is the best one on the market at the moment, and that's why I like it. So my settings are based upon that. Now, again, like we said, some other devices, you can probably use some similar ones, but you do want to check and make sure before you do any of these anywhere. But so for me, I like an 8 to 10 millimeter spot size if I'm treating the face. 10 millimeters if that person has more red and I'm trying to knock out that red. 8 for everybody. Now, then I'll go zero point 0.3 milliseconds and
Standard.
I treat everyone at 4 joules. I don't care what skin type they are. I treat every single person at 4 joules. And I'll tell you why in a second. And then my hertz, so pulse rate is going to be anywhere from 5 to 10 hertz. But my pulse, my pulse energy in joules is 4. The reason why I choose 4 is because, like we talked about, it's like the
Mhm.
comfort level of
Yep.
it. If I can heat somebody up comfortably, could I do it at 8 joules? 100% I could. But if people feel like they're laying out on the beach, they're gonna come back. And if I can heat the skin up in the same amount of pulses, so generally, if I can't get somebody to temperature in like 200 pulses, I'll
All right.
change my
Got like
setting.
something
No, you're
fly by my eyes. It's just like the thumbs
no
up.
worries.
It's a
Yeah.
ghost.
Um, but yeah, if I can't get somebody to temperature within about 200 pulses, then I will change and I'll either increase my hertz if I'm at 5 or 7 or something like that, I'll increase that to 8 or 9 maybe. If I can't get them to temperature, I'll bump it up to 5 and so on and so forth. So if they're not getting to temperature at 5, I'll bump them up to 6. I think maybe twice ever I've had to get to 7, but most of the time I can do it at 4. Um, and like you said, dependent on the speed of how you're moving, maybe you move a little bit slower to build that heat up. So technique wise, how I do mine is a little bit different than how other people do theirs, is I generally try to treat this entire cheek area in one treatment. And I'll go all the way up to the bridge of the nose, up midline to the mouth and midline on the chin. And but I start out in like a little ball area. So I always describe it as like you're spreading out pizza dough. So you always start
Mhm.
with like a little ball of pizza dough. If I can heat that area up and then as that gets to temperature, I start making that area bigger. Because if I start making that area bigger, you're spreading out that dough, you're keeping the temperature consistent, and that allows me to keep the temperature steady the whole time without getting the temperature, now going
Yeah.
over here, losing that temperature over here, quick
Yeah.
go back. So it allows me to be a little bit more efficient with my pulses that way, I feel. Um, and I've never had a problem and people love
Yep.
their treatments. So
Absolutely.
that is my personal favorite. What about you?
I just woke up. So mine is very similar. Same settings. And it's so funny you said about the 4 joules because typically we would base it on skin type, right? And we'd say, oh, lighter skin that can handle a little more heat. We'll put it up to, you know, 8 joules or 7 joules. And it was
Yeah.
so hot. It was like, ow, you'd spend more time adjusting. Dead right. Just stay on 4 joules. And then same thing. I like 7 hertz, probably because that's what I always did prior with any other device. But I do the same thing. Like I'll start here and kind of have this part and then spread, spread, spread. And it's interesting, like if you're teaching someone to do it, and you say, okay, do this half of their face, and they're like, it's not getting to
Right.
temperature. I'm like, all right,
Right.
yeah, slow
Slow
it
down a
down.
little bit. Yeah.
Let's start with a small area and we're going to spread out. And you'll find that this area will consistently be hot. And as you move away from it, it kind of stays. You can kind of get your temp sensor over it
Right.
and it'll be like, oh,
Yep. And then
yeah.
just switch back to it every
And it's
periodically
just
just to like
wonderful.
maintain the
Yes.
temperature. Yep.
The only
Exactly.
thing I would probably change is like if I'm on the forehead, I might even slow it down. I'll probably slow down the hertz. And then if they're
Yeah.
really like, oh gosh, I might even go down to like 3.5. Like, why not? Right.
Yeah.
But the forehead's not really your huge area anyway. And
Right.
then on
Exactly.
another end, if I'm doing anything on the body, I'll go up to 10 millimeter and I will maybe keep the energy a little higher. Like if I can go at a 5,
Yeah.
just because, or I'll
Yeah.
increase my hertz.
As long as it's comfortable. Like face,
Yeah,
I
face is
always I
just
always keep.
yeah.
Yeah. Now, there are people that like a zero point 0.5 millisecond.
Mhm.
What's your take on that? Because I'm not a fan, but it's not. I don't feel like it. I feel like the difference is pretty
Negligible.
negligible at that
It's
point.
weird. I feel like initially I actually did go to point 0.5 because I thought it was more comfortable for the person, and that's great and all, but I didn't see as much of a change with the redness for some reason, which is probably minuscule and doesn't really matter. But I think the point 0.3 is the standard. That's what every study's been done at. So let's just keep it consistent. And that's what I would say.
Yeah,
Yeah,
I agree.
easy.
I like a point
Yep.
three. Um, let's see. Okay, so as far as people coming into the office and um hey, like providers not bringing this on or not doing it because it's not like a very aggressive treatment. I think it's more along the lines of the fear of if people have disappointing
Yes, for
outcomes
sure.
with
Yeah.
their understanding of like the nuances of that treatment. But again, I think what that boils down to is setting proper expectations always. because again, one treatment is not some miracle treatment. It should be a nice little glow for them, and they should like how their skin looks afterwards. But I think that fear of, well, I don't want a negative review, or I don't want somebody to be upset with their treatment, boils down to you didn't properly give them good expectations of
Right.
what this treatment should be doing. And again, that's going to be that whole
I
consistency
agree.
thing, because they will see results 100%. And I've run into the same thing. I've had somebody come in, and I actually spoke about this, I think, on another episode. Oh, yeah, I did. She was demanding that she get an ultra treatment for her redness, and ultra doesn't treat
It's like the one
redness.
thing.
And right. And so, yes, with collagen production, you might see a slight improvement in redness, but it's not targeting reds, it's targeting water. So there's no way that a 1927 thulium laser is going to quote unquote treat redness or rosacea. So I was explaining to her that this was a better treatment for her because she didn't want IPL, she didn't want BBL, she just wanted a nice no downtime or mild treatment. And I said, you're going to need like 5 or 6 of these treatments in order to see a good reduction. And she came back 2 days later after her first treatment and said that the redness is not gone. And I said, we talked about this, but, and I'll take the blame for that totally, in that she didn't properly understand what I was trying to say and what I was trying to explain. And I mean, ultimately, I should have just told her no, because she was adamant about doing something else because her friend did it, but her friend didn't have redness. So that's why I was recommending the proper things, but she wasn't giving it the time that it
Right.
needed. And that's only happened once, knock on
God.
wood. But that's only happened once as far as talking about this treatment. As long as you're talking about this treatment in a way that is like using it as a consistent type treatment where people should be doing it on a regular basis, like working out, like eating healthy, like brushing your teeth, all of the things. You don't just go to the dentist once and never brush your teeth. We could do 1,000 different analogies of what this is like. This is the biggest example of consistency is key with treatments.
It is.
And if they understand that, fine. Are you ever going to run into crazy and they don't like, they're going to sneak past you? Of course. But that happens in this industry, and it happens in a lot of industries. So, right? Who knew? But I just want to make sure that people, like, if you are explaining it to a patient, it should be multiple treatments over a period of time. Whether or not you're integrating it with other things, or you're doing it on its own, like I've done with my mother-in-law, just that by itself. That being said, you can just start here. You don't have to say, oh, well, this is just some ancillary treatment to be added on to something else. I have young patients that are in their 20s and 30s that only do this because they don't want to have to do stuff later on. And it's a great alternative because you are consistently improving the quality of your skin and improving the reds, browns, collagen, pore size, all the fun stuff, without having to do aggressive things later on.
I agree. And I mean, it's a no-brainer. It's great for, brides. You always get a bride who's like, I want to look great. And I'm like, you're if they're very young or if they're not, but it's something they can do, leading up. And it always it just builds and it improves their skin quality. And they end up seeing them through, you know, they've had 3 babies now, whatever. They just keep coming back.
Right.
And it's great. So big fan.
Now, yeah, have you seen any kind of like adverse things happening from laser toning?
You know, Not really. I'm trying to think of anything.
neither. The only thing that I've seen has been burns, and that's from people not doing
Yeah,
it
I've never had
properly.
one on one of my patients. I've not seen one, thank
Oh
God.
yeah, me no,
Thank
I've
God.
knock on
But
wood. Yeah. I've never seen that, but I've seen pictures that people have sent where they'll say, "Hey, why did this happen?" And usually it's from treating too small of an area and not paying attention to the temperature.
you know what? I've had one, I was just thinking, I'm like, there was one situation where it was a friend's office and they had a different device. Similar though, it's a 755 1064. I was like, I said, if you have a 1064, you can definitely do laser toning. We should, play with it a little bit. They only, and I'm trying to remember why, but we used a 10 millimeter spot size. I think it was because there were presets in the device that said use the 10 millimeter. And I was like, I haven't used this one. I don't want to be changing anything too much. And
Right.
it was fine. It was comfortable, all the things. And they were like, I broke out afterwards. And I'm like, well, did you though? I mean, but literally, they're that kind of person. Like, if it can go wrong, it will go wrong. But
Yeah.
I was trying to figure it out, and I was like, well, maybe we went too deep, and maybe it was too stimulating for them, or they purged, or whatever the case. So they were like, I'm never doing that. I said, that's fine.
Well, and I do find like purging and breakouts, especially with
Yeah,
laser toning, because I don't know, the
it's pretty
probability of it
unlikely.
is very
Yeah,
minimal.
usually it's the opposite.
Um, yeah, I feel like those are the people though that don't do anything to their skin, and then all of a sudden, yes, you're doing something, and it's a laser treatment. So it it could aggravate some things and make it a little angry and you purge a little bit. That's I don't want to say that's normal, but I find that it tends to be the people that have literally done nothing, meaning like never had a facial before, never um don't really use skincare, and it's just a mild like even though it's a mild treatment, it's way more aggressive than anything that you're
Right.
used to.
And again, I almost want to go back and be like, can we just play with this again? Because I feel like this is just
Yeah,
so weird. But that was really the only thing that's ever been a like, ooh,
nice.
and it was a big deal. But I don't even know to what degree they broke out. They might have had like one little bump and like, and that's fine.
Right.
I would be the same. But anyway, yeah,
Awesome.
good.
All right.
Hmm.
So, I mean, I think we did a pretty good deep
We
dive
did. Let's
in
see how
laser
it all
toning.
plays out.
Yeah. I mean, so key takeaways. I mean, laser toning, it's not just for
Right.
pigment. It's for fine lines, wrinkles, pore size, pigment, redness, all of
Yep.
the things. Collagen, elastin, right? 1064 is going to be kind of everything. Your deeper pigment, your vascularities, your
Swiss Army
collagen
knife all day
stimulation.
long.
Yep. Long or short pulse. Granted, long pulse I feel like tends to be a little bit better for um like the
And the
reds.
collagen too.
Like if
I think
people
you
have
get a
a
little
yeah,
bit
and
more,
collagen.
or elastin. It's
Um
probably the elastin now that we.
versus your short pulse lasers. So your Pico and Q switch, right? Your 755 toning. Don't do it on somebody that's more than a skin
Or
type 4.
tanned. Yes.
Right, or tanned. If you're combining it, no more than a skin type 3. And that's going to be a little bit better for just overall brightening and like those browns and
What is your
reds.
go-to on the 755?
Setting wise, I still do I mean it depends though.
Let's say
So
it's skin type 3,
so
just general brightening.
so do they have more browns or just is
I'd
it
say
more
more red,
reds?
but some brown.
So more reds, I will do the zero point 0.3 and then I'll still do like very similar setting, like usually like 5 to 8 joules. Uh, and then, and do it the same way, but a little bit bigger of a
With the
spot size
755.
with
Okay,
the
so you're still
755.
doing a point 0.3 millisecond with a.
When it's more reds, if it's more browns and in like more diffuse pigment, I will actually do a 3 millisecond pulse duration. And that gets a little spicy because it's very similar to a hair removal setting. So, like again, can't
Definitely
do
not.
that on somebody that has a beard, because you're probably going to be at about 12 to 16
What spot
joules,
size?
probably.
12 millimeter?
I like a 12. Yeah, a 12, sometimes a 15. But
That's
yeah,
definitely hot.
and there's no
No,
cooling with
you're
that.
still floating. Yeah.
So, yeah, you're still floating though. But that's like more pin pricky. But I mean, especially when people have that diffuse pigment across their mid face, I mean, it's like
You're doing one pass on the 755. Yeah,
one
you're not
pass of
going
that.
back and forth.
One pass of that. If I'm doing the 0.3 milliseconds, I might do like 3 passes, 2 to 3 passes
Oh,
on the
yeah, for
0.3.
755 again.
Yeah,
Okay, got
right. But if I'm truly just treating more so the
it.
pigment, and then yes, it obviously will still help with some vascular too. But if it's more the pigment that I'm worried about, I will do um like the 12, sometimes a 15 millimeter, but if it's on a face, I'll do 12 millimeter. 3 milliseconds, and then usually depending on their pigment, 12 to 15 usually joules.
That's good. Nice. Nice.
Yeah.
That's
I mean, it comes out nice. But that's not something that you're doing every single treatment. So just keep in mind when you're layering all those treatments, which one you're doing first. You're always doing your 1065 first, and 1064 first, then your 755, and deep to superficial. And that's pretty much all your treatments anyway.
absolutely.
Right? Nice. So thank you guys so much for always paying attention to us ramble or not ramble.
We'll see.
Talk about nerdy stuff. Obviously, you can choose to reach out to us through a various number of ways. You can go to my website, www.theandrewaesthetic.com, or you can see me on Instagram. Then that's going to be Andrew Liscio, and send me a DM, ask me a question, ask about how to book an appointment, all of the things. And Carissa, can they find you anywhere? I know you're not really a
I'm a
big
little
social media
hiatus right
person.
now, but you can reach out to Andrew because he's your man. And if you have any
Yeah.
questions for me, he'll forward those.
Awesome. And if anybody has any questions or like case scenarios, granted, I am not treating your patients. Carissa is not treating your patients. That is not the thing. However, if you have, oh, I had this patient, I'm wondering about what I could have done or better. I'm
Me
all
too.
about it.
I love
You
that.
know, those kinds of questions are great. Don't ask me settings. I just gave you settings. Or just in general, if you have like future Q&As, ideas or things that you want to hear on future episodes, send me a DM, send me an email through the website. But other than that, I mean, thank you so much for listening. As always, you guys are great. And if you stayed on for this entire episode and love laser toning as much as we do, I can't wait to hear what you guys think.
Thank you for having me. This has been
Awesome.
great.
Thanks so much. Stay curious, stay glowing, and always wear your
Always.
sunscreen. All right.
Thank you.
Thanks.